Right, morning everybody. Welcome to a sharing of practice session today. We've got Ruben, Matthew and Sophie who are going to share their experience of outreach as part of the STP Professional Foundations module. Just to say that we are recording this session. It will be made available on our sharing good practice section of our website soon afterwards. We will use the Q&A function today for any questions, mainly because this is the only talk today, and it just keep it nice and neat for those that are presenting so that they don't have to unshare and then share again. So enough from me, and over to Ruben, Sophie and Matthew.
Brilliant. Thank you for the introduction, Sally. I'm Ruben. I'm a third-year trainee clinical scientist in radiation safety and diagnostic radiology, and along with my colleagues Sophie Gibbins, who's a third-year trainee in radiotherapy, and Matt Gardner, our training officer, we're going to give a presentation on how we used a healthcare science outreach event in our STP Professional Foundations module. So in our presentation, it's going to be split into 3 parts. I'll be taking the first part and discussing what we did in our outreach event and how it was organised. Sophie will be taking the second part, discussing the benefits to the trainees. And the third part will be taken by Matt, who will be giving the perspective of the training centre and the benefits that came from the outreach event. So, moving on. Our motivation was that as STP trainees, we naturally have several training activities that we need to complete. Usually the professional foundations ones are the trickiest to complete, and we're coming up with a way to basically get ourselves signed off on training activity 10, which requires trainees to engage with the public and or a patient audience to promote understanding of healthcare science. So while looking for a way to fulfill this training activity, we thought that the perfect kind of event to run would be an outreach event centered on Medical Physics Day. And not only would this satisfy the training activity for ourselves and Sophie, but also for all the other trainees that got involved with the day. Signing off many trainees all at once, I'd say, is a great benefit. So previously at our centre, all the medical physics departments, including radiotherapy, the radiation protection department, etc., they used to run a joint medical physics day where they would visit a school and run several workshops throughout the day, educating the children at the school on how physics is used in a healthcare science capacity. And from speaking to those who are previously involved, they spoke fondly of their experiences, and this was something we wanted to emulate within our own outreach event. They in particular they spoke fondly of using Nerf guns. So we'll have a bit more on that later. So our goal was to start back up the Medical Physics Day outreach event. Previously, this had been running from 2013, but only stopped because of COVID. We wanted the event to be inspirational, engaging, and interactive. In particular, as aspiring clinical scientists, we're particularly keen to showcase the role that healthcare scientists had within the NHS, showing to the children that healthcare science or healthcare is more than simply the input of doctors and nurses. Through interactive events, interactive demonstrations, we sought to contextualize the science that they were learning at school and show why our roles have importance within patient pathways. So similarly to how the previous outreach events had worked out, we were looking at running several sessions throughout the course of either a day or a half day. Each session would comprise of an initial presentation outlining our roles within healthcare science, and what medical physics looks like. And then we'd move on to some interactive workshops, and then followed by some closing remarks at the end where the students could ask any last questions they had remaining. So we had 3 workshops focusing on radiotherapy, radiation protection, and diagnostic imaging. In these workshops, we had several interactive demonstrations. The main one for which in radiotherapy was a Nerf gun demonstration outlining the evolution of radiotherapy, moving from non-conformal radiotherapy to conformal. In our radiation protection workshops, we're looking at how we could decontaminate people who have been subject to radioactive contamination, and we also looked at the kind of the amount of radioactivity coming from objects such as uranium, glass, and low salt. In our diagnostic imaging workshop, we had an ultrasound scanner and we had a homemade phantom, so we were having the children guess what kind of objects were within our homemade phantom. As I stated previously, we enlisted the support of all the medical physics trainees within our trust, which was 8 of us in total. So getting started, we were lucky enough to have some equipment that we could borrow from our respective departments. However, for the event that we wanted to run, we required additional equipment. As a member of IPEM, I contacted IPEM to request the use of some of their equipment within their outreach library, and luckily enough, we managed to get some Nerf guns and some contamination monitoring equipment from them. They also kindly provided us with some leaflets to help to share with the students at the end of the day. As well as the equipment, we also needed a school to host us. We were ideally wanting a local school within a few miles of our main site, which is the QE Hospital in South Birmingham. And we had kind of 2 options. We could either contact the schools ourselves, or as we ended up doing, we enlisted the help of STEM ambassadors. This took a lot of the pressure off ourselves in terms of organising and contacting the schools, as they had a bank of schools that they could basically share our prospective event to, and basically see who would be interested. So we had a school in South Birmingham that kindly took up the opportunity to let us have an outreach event there. They contacted the school on our behalf and facilitated our first contact with the school, where we discussed what the event would entail, what kind of students they would like to be involved, the kind of numbers, and the finer details. Also, as another kind of positive for STEM ambassadors, they also organised our DBS checks, which proved to be extremely useful when visiting a school, as it's often one of the things they ask for. So the day itself was split into 2 sessions. So the first group were 100 year 10s of all abilities, while the second group was 60 year 9s, mainly high achievers. Each session ran for about 2 hours, so it was about 30 minutes for the initial presentation and roughly 30 minutes for the workshops with a short closing remark. As personal experience, I think with 8 trainees, we found it difficult to engage with the 100 students, but found that 60 students was a much more manageable number and facilitated a lot more interaction from the students, which we were happy about. We had at least two STP trainees on each workshop, and yeah, the students rotated around each one of the workshops in turn. So we've got some pictures of the events here. On the left, that's our contamination monitoring workshop, which was a success. We had the students wearing the lab coat, pretending that they were contaminated with radioactive material, and they kind of worked together to decontaminate that student. On the top right, we have the Nerf gun demonstration for radiotherapy, and you can see on the bottom right we have our ultrasound scanner along with our homemade phantom, which contained items such as strawberries and pennies. This was us at the end of the day after a successful morning, all very tired as well. But yeah, so moving on to Sophie.
Thanks, Ruben. Hi, everyone. I'm Sophie. I'm just going to talk through the benefits that we got out of this event. So first, I'm going to talk about my experience in being involved in the organisation, and then I'll talk about how the benefits I think everyone got out of it. So it was quite a large event, as Ruben has said, and I think helping organise it, we got a lot more out of it than kind of if we just turned up somewhere and given a presentation. So we had to liaise with lots of different groups of people. So we were talking to the school, the STEM ambassador coordinator, the other trainees, IPEM for the hire of the outreach equipment. So it was really good to help develop those communication and organisation skills. It was also not. It wasn't an insignificant amount of time to organise, so it was a good test balancing that alongside the other commitments of the STP, doing training activities and uni work and everything. And then we had the help of the other 6 trainees in the trust, so it was a good opportunity to develop some leadership skills there. So we had meetings with them prior to the day to get their input. We delegated some work to them to help set up the stations and everything and organise the activities. So I think that was really good. And then there were also some aspects that I hadn't really considered before we started the process, such as like writing a risk assessment for the day to give to the school, and coming up with a timetable that worked for both the school and us for running the day. And having not actually done an event like this before, that was definitely a bit of a challenge, kind of thinking about how it would all work logistically. And yeah, there was a bit of guessing there, but I think on the whole it went well. As Ruben said, I think with the group of 100, that was probably not an ideal number of students, but we'll know that for if there's a next time. And then it was, of course, a really enjoyable and rewarding experience. I personally didn't know about careers in medical physics until I was at university, really. So I think it's great to be able to share this with people at school, and just, yeah, seeing people interested in asking questions and engaged with it was really good. Go to the next slide, please. Thank you. So for all the trainees, as Ruben said, we're all now registered as STEM ambassadors, which is really great, because if anyone's interested in doing further outreach work, it should be easier now. There was also, it helped develop presentation skills. So we were presenting to, a young lay audience and trying to make it fun and engaging. So I think that was a real test of everyone's skills there. And obviously no one had like any training in kind of classroom management or anything. So there are definitely some skills we picked up there. I also think it was kind of a good test of our knowledge of our own specialisms, because we're trying to communicate what we do in a accessible and engaging way. So I think that was a good test. And then obviously that thing of being involved in helping to potentially inspire people to look into careers in healthcare science is really good. And then, of course, everyone did get that training activity signed off. And Ruben and I had actually already done that. We'd done some previous outreach work and had that signed off already. So we each did a CBD, again, for the Professional Foundations module on the day and how it went. Thank you.
Cool. Thank you both. So hi, everyone. So I'm Matt Gardner. I'm a clinical scientist in radiation safety, and I'm the medical physics training officer here at University Hospitals Birmingham. So we were really happy with what our trainees did on the day to celebrate Medical Physics Day. So I'm just going to try and tell you a little bit about what it was like for us as a training centre and why we wanted to do this. So as Ruben kind of alluded to, our department here at UHB, we have a good history of trainee-led outreach. So back in 2013, our professional body, the International Organisation for Medical Physics, and the UK professional body, which is IPEM, declared that there will be an International Day of Medical Physics every year on the 7th of November. That started in 2013. Back then, I was in the final year of the STP, and we decided to celebrate by doing a schools event, and it became an annual thing, something we wanted to do every year and get our trainees involved with. We did it really well. It became part of our departmental culture, and I just would like to show off a little bit that back in 2015, when we were at the peak of this, we were runners-up for an award for public engagement at the NHSE Healthcare Science Awards, which I just mentioned to show, you know, what a big thing this was for us as a department and how important it became. Obviously, because of COVID, we had to stop doing these events. Obviously, not only could we not physically visit a school anymore, but also obviously everything was reprioritized, and this wasn't something that we were able to carry on doing. But that's been about 5 years now since we had to stop. So we started to feel this is really time we got back into doing this, and that this should become something we look at doing. It's also important to us here in Birmingham because we're a very highly populated city. There are, I think, about 20 or 30 schools within 3 miles of our main site at the QE Hospital, Birmingham. We're also one of the most diverse cities in the United Kingdom, and this gives us a very large pool of potential scientists that we can reach. It's also helpful for us that being a large centre, we had at the time we had 8 medical physics trainees at different stages of the STP, and that gives us a wide pool of people that we can call on to help with this. But we also have trainee technologists, we also have registered clinical scientists and qualified staff who like to get involved in outreach as well. So we don't have to isolate it to trainees. It was just helpful to do it on this occasion. So if I can have my next slide, please. Thank you. So I think it's important to say why on this occasion we wanted it to be trainee-led. Our events have always been trainee-led, just not always kind of trainee exclusive in terms of the staffing. But you see it when people deliver outreach that trainees bring a very fresh enthusiasm about the topic. In a way, it's still kind of new to them. They're excited. This is all new learning experience. And they get to discuss those scientific topics and the careers. And importantly, they can relate more closely to what school pupils feel about their careers and what they want to know, because they're not that far into their careers. You know, only a few years ago, they were asking these questions themselves. And, you know, like me, 10 years into an established career and that kind of thing, I don't relate as closely to looking for a career and trying to find out what I'm going to be doing with the next decade of my life. And the other reason we want to do this is it's an opportunity for trainees to lead on something. So every year or a few times a year, because we have multiple trainees, we have a multi-source feedback question, and we get asked the question, how can trainees develop as leaders? And it's difficult on the STP sometimes for trainees to get experience of being a leader and to leading a project. But this is something that we can very comfortably and very happily hand over for trainees to lead on, you know, with a bit of oversight from management, kind of checking in and making sure it's all going well and this kind of thing. But the day-to-day running, very much a trainee-led thing. So they can have guidance where they need it, but they can lead on it. It can be their project. And the way we've kind of structured it from now on is that we have trainees in their specialism, so the kind of 2nd and 3rd year level, they can lead the event now. And rotational trainees, we expect them to participate now so that they gain experience ready for the next time. Okay, so next slide, please. So in terms of the short-term kind of immediate benefits we get out of doing this, is we raise the profile of healthcare science, not just outside, but within our own organisation. So what I've put there is that's our trust LinkedIn feed, where they got very excited about that we were doing outreach, and they posted about it, and they even posted about this good practice session as well, which we were really happy with. And even within our own trust comms team, I think healthcare science can be very much a background activity. We're not always directly patient facing. We're not like doctors and nurses who get a lot of visibility naturally. So this is a really good thing we can do, even within our own organisation, that now I've got 2 or 3 contacts within our own trust comms team that we can start to push healthcare science to. And then obviously we push beyond our organisation, because we're in a school, we're talking to pupils, but importantly, we're talking to teachers as well, who are picking up bits of information that they can use to give context in their future lessons. So it's good for them as well. It's also good for us, as Ruben and Sophie have mentioned. We managed to sign off some professional practice assessments by doing this. So for all of our trainees, we were happy for them to put this towards their training activity TA10 on being ambassador for healthcare science. And they all wrote really good reflections of it, and kind of we could use the photos as evidence and this kind of thing. And for those leading the event, we were happy to do a case-based discussion on that, where we could kind of probe what they were doing, we could probe what they learned about leadership, and it was just and that just provides us something else that we can get covered with a trainee-led event. So can I have my next slide, please? We also have longer term benefits. The first thing we kind of can use to measure this is feedback from teachers and pupils. So our teacher described it as a resounding success. The pupils were captivated by the interactivity and the engaging talks. They learned about the vital role of physics in healthcare, and we covered a few different topics there. The pupils asked a lot of questions because it was interactive, it was interesting. Our trainees were engaging. From our pupils, we heard that they went to a medical physics workshop and they learned how physics is used to save lives. Importantly, they didn't know much before, but now they understand a lot more. And beautifully put, I think it's amazing how science can help people. That's something that we already know. We're healthcare scientists, but we can put that to school pupils at a very young age. And this other bit of feedback I put is after the workshop, I'm fascinated by sonography. I want to use sound waves to create images of the body, helping diagnose and treat patients. It's amazing that technology saves lives. I am determined to study hard and become a skilled sonographer. A couple of people pointed out to me that just kind of, oh, we're supposed to be doing healthcare science outreach, but sonographers are allied health professions. I'm a bit like, so what? The NHS isn't just doctors and nurses. That's a key line that we can push, that we can promote to school pupils. So even if they don't become healthcare scientists, we've opened their eyes to a much wider range of healthcare careers than they might get day-to-day exposure to. So I'm really happy to see that as well, that we're encouraging engagement with a wider range of health careers than people have thought about. Okay, so my next slide, please. Oops, sorry, I just saw something in the chat. I'll come back to that. Other long-term benefits are using Medical Physics Day to produce a pipeline of trainees engaged with outreach. So as I've mentioned before, this is an event being led by specialism trainees, and then rotation trainees get to participate and get some experience, and then they get the opportunity to lead the events the following year. So now we have an engaged pipeline of trainees. It was great to be there on the day, so I was kind of going around taking photos, having a look at what was going on, and you could see over the course of the day our trainees were kind of growing in confidence and delivering the messages and engaging with the pupils. It was really great to see just in that short term. And we do have trainees now who ask, oh, can I do a bit more outreach? You know, this event is going on, and it's brilliant. And where we can facilitate that, we do. And we're also forming links with schools and with our local communities, which is really, really important for us as healthcare scientists. It's good for our trust that we're making those connections. Okay, so my next slide, please, is to say thank you very much for listening. I think we're all hanging around to ask a few questions, so I can hand back to Sally. Thank you.